which will take us to 2 o'clock. And Gloria, Brian, you and Antonio, you can remain with us or you can leave us, but it's been a pleasure. All right. You've been standing and listening for about an hour. We are not really going to take a break because we want to stop at 2, but you could stand, you could stretch, you could do your exercise, you could do exercises that will cause me muscle cramps, you could do what you have to do. And we're just going to move to the next phase. And I'm going to tell you that we have a Q&A is open and it's being monitored. So send a question at any time. Justice, His Worship Mangesh Duggal and I work in the same courthouse. And I remember running into him one day and says, I'm going to do my master's in Berkeley. I'm like, interesting. I mean, he was going to do his master's in Berkeley. And I even got even more interested when he told me what the topic was going to be on. It was going to be on drug treatment courts. I was like, wow, this is a prestigious university, going to spend some time to do that. So he's going to talk about his the results of his research, and he's got his thesis is called "Long May You Run: Drug Courts in the 21st Century." He was called to the bar in 1992 after attending Osgood Hall in Toronto. He worked as a sole practitioner in the areas of criminal and immigration law. He's appeared in the Court of Appeal of Ontario Superior Court of Justice, Ontario Court of Justice, and he has been a federal crown on a per diem basis. He was appointed a Justice of the Peace in Brampton in 2009. In 2015, he obtained his LLM from the University of California at Berkeley Law. He was an associate editor on the Berkeley Law Journal of Criminal Law, as well as the Asian American Law Journal. The guy is an athlete. I mean, he was on the LLM basketball team and a member of the old wiser law students. Assume that must be a basketball team. And his thesis that he's going to talk about, Long May You Run: Drug Courts in the 21st Century, has been published in the Berkeley Law Journal of Criminal Law. He's also written articles in the Criminal Law Quarterly and the Asian American Law Quarterly. So, Your Worship, over to you.
Thank you, Kofi. Much obliged. The organization was called OWLS, so it was older, wiser law students. So all we do is, older, wiser law students, and we hoot.
Okay,
that's about as far as we go is hooting. Thank you, sir. There's a great quote. It's by George Bernard Shaw, and he said, "We're made wise not by the recollection of our past, but by the responsibility for our future." Now, I'm going to read a quote, and I'd just like everyone to think about it. Let's just say it's a form of not quite trivia, because the subject matter is very important. But listen to the quote, and I'm just going to ask everyone to keep in mind, who do you think wrote this, and where is it written from? So the quote is as follows: addicts share needles, inject hurriedly in alleyways, and dissolve heroin in dirty puddle water before injecting it in their veins. In these back alleys, users who overdose are alone and far from medical help. Shared needles transmit HIV and hepatitis C. Unsanitary conditions result in infections. Missing a vein and the rush to inject can mean the development of abscesses. Not taking adequate time to prepare can result in mistakes in measuring proper amounts of substances of the substance being injected. It's not uncommon for injection drug users to develop dangerous infections or endocarditis. These dangers are exacerbated by the fact that drug users are a historically marginalized population that has been difficult to bring within the reach of healthcare providers. I'm going to give everyone a moment just to think about who the author of that quote is. And the author of that quote is the Chief Justice of the Supreme Court of Canada. It's Justice McLaughlin, as she then was. And the case was called Canada versus Public Health Services, the Community Services case from 2011. at the Supreme Court of Canada, also known as the Insight case. So when you take into consideration those observations, and I'll get back to that in a minute, and I'm talking here today about the efficacy of drug treatment courts, it's important to keep in mind that those observations were made 10 years ago. And a lot of people have talked about, and this lecture is in honor of Justice Bentley. And by the way, if anybody wants to just kind of download my pieces, all you have to do is type in Mangesh Duggal, Duggal, Berkeley Law, and Long May You Run, for those who may know and those who may not. Neil Young is a singer, and Long May You Run was one of his songs. So you can just download it, and the published article was a shorter version of the thesis itself. So I'm going to just briefly talk about drug treatment courts and what they are and their relationship to restorative justice. Then I'm going to talk about some other commonalities, because I'm not sure everybody in the call may know about what problem-solving courts or drug treatment courts are. You'll have heard a lot of how people set it up in terms of design and implementation. But essentially, drug treatment courts are a cousin of the restorative justice movement. And if you look at the history of criminology, and I think one of the things that's kind of cool is in criminal law, we often don't study criminology, but one of the key notes of criminology is how do you do regulation? And it really, that's the key question in terms of, putting it in the sharpest type of relief or duality. And the key tension in criminal law is between a punishment-oriented and a problem-oriented regulations. And DTCs, drug treatment courts, are a focus on a problem-oriented prism. So both drug treatment courts and restorative justice see significant failures in the adversarial criminal justice system. One of the common critiques is the McJustice approach. The McJustice approach is that people are basically, it's a cyclical cycle, and much like that restaurant. By the way, I should also say, like Croft and Paul, my observations are simply as a personal, separate legal student. They're in no way reflective of a public or an institutional endorsement. But McJustice, we all know that eating at McDonald's, it may be quick, but it's not good for you. And that's what McJustice is. It may be quick, but it's not good. And so it's restorative justice scholars, they see that in the criminal justice system, and they're both trying to figure out ways to resolve disputes within a broader social and factual context. And they're trying to use resolve conflicts with the goal of what's sometimes described as holistically analyzing conflict. So I think one of the things that Paul and Justice Bernstein, Paul, if he doesn't mind me calling it, and Sheila, what they've identified is who exactly is in the program. And for me, the definition of who gets in and who doesn't can be either expansive or narrow. And, when you look at the history of drug treatment courts and how they evolved and where they are, sometimes it's quite interesting. For example, there was a Hamilton County drug court in Ohio who established the following criteria for admission. It had to be criminal conduct that was drug-driven. It had to be no history of violent behavior, no active mental illness. No active mental illness was an excluding criterion. And no acute health conditions and a stated willingness for treatment. Well, one would think, and I believe that drug addiction would have been the exception to that mental illness. But that's how if you define things too narrowly, it can limit who comes in and who doesn't. So there's 6 features of drug treatment courts. You've heard them all. Enhanced information, so a complete kind of social historical background of the person concerned. Community engagement. Courts generally aren't involved in community engagement. The idea was that judges should remain impartial and above the fray, and you don't get involved in the community. Collaboration, as you heard through Croft's discussion, Paul's discussion, the social worker community, the medical community, the public health community. There's collaboration and a teamwork approach, individualized justice. There's a principal concern with courts is getting through a docket, and the idea with it, looking at things in terms of delay is, how many cases can you get done in a day? How many cases do you have? And drug treatment courts and the whole problem solving movement tries to flip that around and look at, outcomes on an individual basis and individualized justice. And then the other two factors relate to accountability and outcomes. That, in a traditional court, you sentence someone, they're sent to probation, and that's the end of it. Whereas in drug treatment courts, you're really looking at results, accountability, and outcomes, and they're critical to those programs. So we heard a bit about the design and the implementation, but it's really important to consider the historical genesis. It was touched by Paul, and it was basically drug courts. It's a completely American phenomenon in terms of their genesis and how they started. And they started, and it can't be forgotten that they started as a result of mass incarceration, the phenomenon of mass incarceration, and it happened very, very, very quickly. If you look at how they all started, the observations were Janet Reno in Miami started one set. There were judges in Kalamazoo. I met a judge who started the drug treatment court in Kalamazoo. There were judges in Oakland that started, but essentially it was due to overcrowded prisons and jails. And the overcrowding in the prisons and the jails were due to the punitive drug policies, mandatory minimum sentences, and drug courts were an attempt to expand the boundaries of conventional criminal justice by basically defining drug use as not simply a criminal issue, but criminal, medical, behavioral problem that was conducive to court-monitored therapeutic interventions and sanctions. So therapeutic justice generally informs the theory and practice of problem-solving courts. Justice Bentley recognized the relevance of therapeutic jurisprudence, and I'm gonna quote. There's a quote that I found of his, which was and remember, the interesting thing. I mean, studying drug treatment courts is really, really cool. It's really interesting because it involves a number of things. It involves the interaction between science and how science is evolving in terms of the addiction of principles of addiction medicine and science. And you look at scientists like Nora Volkow. It also involves the interaction between law and culture. And essentially, we in Canada, through Justice Bentley, we were incorporating an American phenomena. So we had to apply our own culture, our background, our norms, our mores in relation to that American phenomena. And what Justice Bentley said is, and once again, he was talking about the American model, we want to use what you've done well, ignore what you haven't done so well, and adapt the model to our local use. I think we can use the ideas that you have to suit our local communities. So in relation to that issue, one of the issues was what kind of an approach are you going to follow? And it was pretty early on that the therapeutic approach was the appropriate kind of model, and Justice Bentley also observed that with more serious offenders, the drug treatment court employed a harm reduction model. And very early on, very, 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 very early on, historically, endorsed the prescription of methadone. Endorsing meaning, utilizing it, obviously not in a medical context, but also, what's important in terms of drug treatment courts and therapeutic justice is the language that you use. So rather than, referring to treatment, Ontario officials prefer the terms education and intervention. And as Croft noted, there was a flexibility and open-ended approach in terms of the leaders from a prosecutorial side, from a defense side. And Justice Bentley was really, in some respects, kind of like the paragon of all of those participants, because that quote itself reflects some flexibility. It doesn't reflect a dogmatic approach. And it really is an acknowledgement that what's going to happen in the Toronto Drug Treatment Court is going to be a hybrid or a balance between the American approaches and the English approaches. Remember, by now, drug treatment courts are all around the world. They're in common law jurisdictions in Australia, in Canada, in England. So that's kind of like the background. Now, it's important when you're determining success to not divorce reality from theory. And it's and you always got to keep in mind, and my talk or my discussion is about success in the context of what we're facing now in terms of an opioid crisis. But success has many faces, and actually, just getting back, we shouldn't. We should always look at what the foundations are. How did drug treatment courts start? What was their response? And what I found really interesting is historically, drug treatment courts share something in terms of law reform with two other movements. Remember, it was mostly, I'm talking about Canada and America. England, it was a little different, but it was a grassroots, bottom up approach to law reform. And it didn't happen with at the local level with all local communities. It happened, as I noted earlier, Miami, Kalamazoo, Oakland. And what was also very, very interesting is how all of the participants, and Toronto as well, how all of the participants kind of engaged in this getting on a circuit like you would in the old, in the 1800s, you get on a horse and you go to the other towns and you figure out what they're doing right, what they're doing wrong, and you adopt and you learn. And that approach, it happened in obviously the conference in Niagara Falls where everyone goes down. It happened in Kalamazoo, it happened in Oakland, and it also happened in Miami. So, in terms of success, so success has many facets. What I'm going to do is 10:23 now. I'm going to leave about 15 minutes, so I'll be done by hopefully around 1:45. But essentially, success has many faces, many optics. But I think one of the first things to consider when you're looking at drug treatment courts is cost savings. And there have been, there was, I looked at a number of studies. There was something called the impact of a mature drug court over 10 years. And that study, now keep in mind, this is, stuff that was done 6 years ago. So, but those studies are still valid. So in terms of net savings, the results indicated that generally drug courts saved tax dollars compared to simple probation or imprisonment. And all persons diverted to drug court would not necessarily have been jailed, but for those who are incarcerated, the average cost is about, and once again, these are American figures, and they're from 2005, but it was about $23,000 per inmate, while the cost of drug court participation was estimated to be about $4,300. The Government Accountability Office looked at drug treatment courts in a broader kind of like a meta-analysis and said that the net benefits are usually from $1,000 to $15,000 per participant due to reduced recidivism and avoided costs to potential victims. And then there was an evaluation of 11 drug treatment courts in Oregon, Washington, Kentucky, Missouri, and they all found substantial savings, with Oregon specifically being, once again, this is cited in relation to the earlier studies. I've got sites, but it was the drug treatment court was, in Oregon was estimated to have saved about $3,500 per participant, once again, due to reduced recidivism and incarceration. And then the 6 drug courts in Washington saved on average about $6,800 per person. And this is Washington State. And then there was a study of 5 drug courts in Washington that found a benefit at a micro level about $1.74 for every dollar invested in drug courts. So the benefits outweigh the costs and an overall decline in recidivism from a cost benefit analysis. And a study in St. Louis found there was about that the initial cost of drug courts, which is about $700-800 per graduate, it's exceeded that of someone completing probation, $6,300. But after 2 years of completing the program, drug court graduates are really realizing a net savings of $2,600 per person, resulting from lower jail costs, reduced crime victimization, and healthcare costs. So on the issue of healthcare, I think a lot of the focus on success has been on recidivism, but I really think it's sometimes important. And this study kind of looked at it in terms of like what the average cost was, but it's important to, especially nowadays, it's important to consider the issue of hospital admissions. And hospital admissions may be a reflection of recidivism back in court, and sometimes a survey of all the studies shows there's very little research on hospital admissions. But in my view of things, and obviously it needs to be subject to analysis, but I suspect that if you look at hospital admissions and you look at a frequent intravenous user that the Supreme Court of Canada identified in Insight, you would see that if you see a drop-off in hospital admissions, then that will also be reflected in criminality or in interactions with the court. It may not be it may be an indirect relationship. I mean, there may be minor criminality that happens, but I think there is a connection or a relationship. So the next area I'm going to talk about is the recidivism studies. And the first one was the Baltimore City Drug Treatment Court. This goes back, it was formed in 1994. It was formed in part due to a Bar Association study in Baltimore, which found that about 85% of all crimes in the Baltimore area were drug related. And the BCDT, so the Baltimore City Drug Treatment Court, it was similar in form and function to other drug courts, offering either post-adjudication or diversion types of processes. And during a 2-year follow-up, 66% of the drug court subjects and 81% of non-drug court offenders were rearrested. So there's a significant statistical difference in terms of the drug court subjects and the non-drug court subjects. And in addition, the number of new arrests was 30% lower for drug court participants than those in the conventional stream. So you have Baltimore Drug Treatment Court, 1994. The next kind of analysis was the Sentencing Project, which is a national nonprofit agency. And in 2009, they conducted a survey on drug treatment courts. And their purpose was to outline general findings on the workings and efficacy of drug treatment courts nationwide in the United States, and to target research where research is required. And the overall observation, subject obviously to the idea that, unlike the objection to McJustice and a cookie cutter approach in a conventional adversarial system, drug treatment courts are different, and each court is going to have its own implementation, design, structure, form, function, and each one's going to vary. So it's a little hard to kind of draw conclusions from, and actually that's one of the things from the research that may prevail me down the road. Who knows? We'll see what happens. But what are the factors leading to individual success within the drug treatment courts? There isn't a lot in terms of the research. Nonetheless, what the Sentencing Project found out, or what it revealed, was that there were 76 drug courts, and there was a 10% reduction in rearrest. And pre-adjudication courts had a 13% decline in rearrest. There was another analysis of 30 drug court appraisals, and there was a 13% decline in a re-conviction of a new offense. And then there was a meta-analysis of 57 studies that participation in a drug court would result in an 8% decline relative to no treatment. And then the General Accountability Office, that's affiliated with the Congressional Service of and the legislature in the United States, found that 13 of 17 courts reported on post-program recidivism measured reductions between 4 and 25%. So the Sentencing Project concluded that although drug courts were achieving important benefits, more research was required, in part because of what I identified earlier, that there's, each design implementation is unique, and it's a little hard to establish, overall kind of what the success indicators are going to be and how you can kind of guide public policy. There was also concern that drug courts could be increasing the number of those arrested for drug crimes instead of decreasing the number of incarcerated people. So until about what I found, and once again, there may be studies out there that I missed, and that's, part and parcel, and that's my fault, but there wasn't much in terms of Canada. But in 2013, there were a number of scholars that, and there's a great journal. In doing research, who would have thunk this, that there's a journal called the International Journal of Offender Therapy. There you go. It's there. It does research on criminology. But a number of authors, they conducted a Canadian study involving the effectiveness of a drug treatment court in subgroups defined by ethnicity, gender, offending, and the presence of a co-occurring mental disorder. And what they discovered, this report, was that there were greater reductions in recidivism among Aboriginal participants, and specifically female Aboriginal participants versus those with the presence or absence of co-occurring mental disorders or the number of convictions. What was also interesting is that one of the factors, and all social science may sometimes come down to culture, but culture seemed to play a very, very, very important role in terms of the success of the female Aboriginal community in that particular study. And it concluded that the effectiveness of DTCs, drug treatment courts, with unique subgroups may be connected to their compositions, inclusion of expertise, specific to the needs of the participants. So, in terms of the overall efficacy and research, it seemed to suggest that for subgroups of offenders, specific motivations and strength of commitment were good signals for adherence to program requirements and program success. And once again, this was a study that took place in the context of very little being known about drug treatment courts in the Canadian context in relation to outcomes and the individual traits of the offenders. That's also in part because we don't really, unlike the United States, we're not statistically driven. We don't have the same database that they do in the United States. But there's been a shallow base in terms of, adapting the US model to other countries, in part because, mandatory minimums, habitual offender laws, enhanced sentencing regimes, and subjective differences in offenders, they're completely different in the United States than they are in Canada, than they are in England. But what was important in that particular study was it studied the Vancouver, downtown Vancouver East Side. And that is important because this was a study in 2013, because the Insight case from the Supreme Court of Canada came down in 2011. And what the Supreme Court of Canada noted is that since the opening of the needle exchange program in Insight, there'd been a reduction of open air injection use. There was no evidence of drug loitering. And once again, the Supreme Court of Canada didn't make those findings. It was simply repeating what was, I think the justice was Justice Pitterfield, and he had made those findings at the Superior Court level. So the Supreme Court was just repeating or reiterating what the judge made in terms of findings of fact. But, in looking at Insight, it seemed to suggest that, drug injection sites, that there was a reduction in petty crime in the area around Insight. And then an advocacy group called the Chinese Business Association reported reductions in crime in the business district around the Clean Needle site. So the rate of crime in the DTES, that's the downtown East Core, seemed to be, the rate of crime was stable, and the overall cost benefit analysis was positive. So that's it in terms of, kind of like a summary of success, efficacy. Drug treatment courts work. They're cheaper than the custodial sentence. They may be judge intensive and intensive in terms of resources. But in the context of the alternative, which is probation, a higher failure rate when you consider the cost may be acceptable. And then all of this needs to be considered in the context of when I started all of this. Actually, the reason I was interested in drug treatment courts is I had my own experience where a Punjabi woman came up to me, and I was approving her as a surety for her younger sister. And her younger sister was in her early 20s. And her younger sister was addicted to heroin and was recycling through the courts over and over again. And in Punjabi, she basically said to me, she started crying. And in Punjabi, she said, "Sir, what can I do about my sister? Where can I go?" And I was approving her as a surety. And that story, and that kind of was the genesis, and it kind of was the start. And you know, drug treatment courts, at the end of the day, what I also found very cool and very unique, and I just love it, is that it gets back to stories about the law, and stories, and they're not fictional stories. They're stories about human beings and their lives and their struggles. And there's also something that I find really, really interesting. I mentioned the two, so the two movements that are similar in terms of, you know, I don't know if I mentioned it, from a bottom up approach, are interestingly enough, the abolition movement to ban slavery and the prohibition movement. They were very similar in terms of that approach. But I also find that among people that are adherents or supporters of drug treatment courts, there's a real enthusiasm, almost like a messianic quality, but I don't think it's zealotry. I don't think Justice Bentley was a zealot. I think it's just a recognition that, you know, you enter law, some people enter law to make a difference, and you really see how you can make a difference in drug treatment courts.
Right.
So that's it, sir. Thank you thank you very much, Justice Bentley. Thank you very much, Justice Barnes Kofi. And obviously, my thesis was dedicated to the memory of Justice Bentley. I think there is someone that's connected to Justice Bentley that's a participant, and I'm just grateful to him. And we just gotta, you know, and long may we all run. Is all I can say.
Right.
Thank you, sir.
And just to sort of focus, because we're going to get to a question in a moment, and I have a question for you myself. But my understanding is that there are a couple of takeaways, things that you want us to take from this, right? And one of them you've told me is that you want people to understand the drug treatment courts are a cousin of the restorative justice movement, and in fact they are as much as there's a tension between punishment-oriented approaches and problem-oriented approaches, drug treatment courts focus on problem-oriented approaches. And my personal comment is that is not unique to drug treatment courts. All justice treatment collaborations tend to have problem-solving type of problem-oriented approaches. And also, you and Justice Bernstein talked about how we define our target group, whether it's drug treatment court or anything. That in terms of a justice treatment partnership, is important, right? We can either it can be narrow or it can be broad, but it has an impact on who gets in, and it has an impact on the ability to ensure that the resources reach the people who need to be reached. And you also talked about how drug treatment courts are a subset of problem-solving courts, and you set out some 6 criteria that, you know, it enables there to be enhanced information as the first one, that allows there to be community engagement as the second one, and allows collaboration, you talked about, allows for individualized justice. And in fact, you know, last month we had Paulette Walker talking about her experience in drug treatment court, and individualized justice was a very important accountability and also some outcomes. Now, this is my question. One of the things that you also said you wanted us to take away from this is that, I'm going to use your words here, the normative or normative basis should be referenced, should not divorce theory from reality. What did you mean by that?
What I meant by that is you always have to look at the genesis of why do we have drug treatment courts? What were the underlying bases? And those factors, overpopulation, recycling of offenders, drug addiction, those factors and what they were intended to do in terms of using a problem-solving approach, look at that when you're going forward in terms of deciding to remove someone or using a sanction-based approach. One of the judges I talked to in Kalamazoo, actually, it was one of the founders of the drug treatment court. He said that there were some other courts where there was a zero tolerance approach, that once you start using or offending, you're out automatically. And I think someone else had mentioned that. I think it might have been the person that was connected to CAMH. And like the whole zero tolerance approach was why there were drug treatment courts were created in the first place. So just look at that as Justice Bentley was: be flexible, be open-minded, and just look at why things were done normatively, which are the normative bases are the ought to be questions, the ought to be values, like what's at stake, and don't go too far astray such that you kind of get into a black and white letter law approach versus, you know, kind of looking at why the courts were founded in the first place. So that's all. Don't go too far from don't stray too far from theory.
You know, and just picking up on that comment, actually, it's interesting because those 6 people who we talked about were real pioneers. Because when we started to do work internationally, we realized that Canada was actually the first court outside the United States to come up with a nice blend between harm reduction and abstinence. So the treatment component was harm reduction all the way, and you did not get sanctioned for drug use. However, there was to complete the program back then, you had to sort of get off the drugs, and then get abstinence, and it took several months to get there. And then there started to be a development on what is success really, right? Somebody may have stopped using, may still be using, but they can still maintain jobs. You know, crime has come down and all kinds of stuff. It's a very complex topic. But anyways, we have to get to your questions for you. But there were a couple of other things also you wanted us to take away from this. And that leads to what I just said. Success has many faces, right? And that's one thing that we learned. There's the cost savings issue, which is quite clear, but there are also quality of life issues. There are also crime reduction issues. Though it's very, very complex. And persons, as they involve in these programs, reduce their reliance on, let's say, hospitals, emergency medical services. And there is a very interesting thing, something that also came out from when Ms. Walker spoke to us, the reunification of families, the healing of human interaction. And one of the things that we find interesting is during the pandemic, we've come to realize how important interaction with ourselves and our families are, right? And so the social cost of that. So it's trying to define success. So that's one of the things you talk about. And one of the things you wanted us to, and that falls into your issue about public health, right? Trying to take into account the issues of success. And then you also, one of your also takeaways was that we should always remember why these programs were set up in the first place. So you say, when you're dealing with people, when you're designing your program, when you're trying to move forward, remember the historical genesis of drug treatment courts. And we don't have time to talk about, but you talked about how therapeutic jurisprudence greatly influenced drug treatment courts. And of course, in my head, I'm saying, oh my God, that's another topic for the future, right? Therapeutic jurisprudence is something that we can talk about in a webinar in the future. But having said that, one of my colleagues is going to take us through the questions. I have no idea who that person is, so I'm just waiting for that person to suddenly appear. Okay, there we go.
It's Andre Rivard again. Thank you, Your Honor Barnes, and good afternoon, Your Worship. I think the last
Andre, you know me. It's Mangesh, please. Thank you.
Yes, absolutely, and great paper. You had shared it with me before today, but it's really important that a lot of the guests are enjoying this. Really nice flow of conversation. The last 2 questions His Honor just posed, you are touching on a question that Justice Ray had typed. I think she'll be impressed or satisfied with your dialogue so far, but I'll just recapture what she had typed. It. I observed it. The question came in right when you were exploring the sentencing project results and how we define success. Ultimately, this question of who gets into a program is key to that discussion, and how those numbers can sort of correlate to one's success. I think for all the social service providers on the call, we talk a lot in Brampton about determinants of health and what are the markers that lead some clients to do really, really well versus others that really can't get that momentum going when they come into our program. I think the prosecution's office, when they evaluate files, are thinking like that. It's natural to think in law about assumptions that can be made or assessments that are made quickly and giving the client a chance to do well. Do you think, or do you observe in your study from the US data that results and sort of outcomes in terms of success can be tied to the profile of the client that enters and what surrounds them that can be a marker of success as well?
Okay, so in the United States, there are two factors. There's one thing that's really defined how drug treatment courts view success in the United States, and that's funding. And so the pursuit of funding, because the principal funding for drug treatment courts, and by the way, I should note, just going forward from Justice Bentley's time, if people followed the presidential debates, the second one, the President Biden, or nominee Biden, as he then was, specifically mentioned drug treatment courts in the debates as an answer to mass incarceration. So in the United States, the notion of who gets in has been really determined by funding. And if you have a high failure rate, then you don't get funding. And so separate and apart from, excluding people for violent offenses, excluding people, there's some drug treatment courts that exclude people who aren't citizens. If that's the basis, or the end goal is funding, then it really limits who can come in and who can't. And in terms of factors regarding success, once again, I hate to say it, but the one motivation, and specifically that 2013 study from the Vancouver East Side, seemed to suggest, certainly in the group that was the highest, that had the highest success rate, Aboriginal women, that culture plays an important part. That if you have someone that you can connect with, talk to about your background, you'll feel comfortable. That seems to lead to success. So as much as I hate to say it, culture is a factor, and language barriers, etc. That's a factor. But in terms of predictors, that's one of the things I kind of got from the research. There's nothing in terms of predictors of success for courts, because they're all uniquely shaped. So
let's talk about success, though. So how do we define success? I think courts will leave it to themselves to kind of evaluate whether or not that means making a meaningful impact in the client's life, whether or not success comes in different sort of definitions. I think that's important for programs to turn their mind to. And that's a question that comes from Robin as well. Any thoughts on that? In the US model, do you find maybe geographic differences in success? Do you think it's left to the devices of the local committees, the steering committees? I think maybe it requires a bit of a culture shift, and moving forward, we can look at whether or not, is recidivism the best marker of success, or is it quality improvement in life? Yeah.
Well, so maybe I can answer that in two ways. First of all, I can answer that by looking at some of the science, because the science in relation to addiction medicine from Justice Bentley's time is it's remarkable how significant the science has been. And there's a scientist, a neuroscientist named Nora Volkow, Volkow. Just by way of background, she's actually Leon Trotsky's grandchild, I think. She has basically said that when you talk about long-term users, their desire to reoffend or not reoffend or use again may be a function of the collapse of the synapses in the brain. And that's why there's that desire to sometimes use, even though someone's been clean and sober for many, many, many years. So, in terms of success, I do think that, if he can get out of the recidivism back in court, what Justice Bentley noted and what he observed, Justice Barnes observed, I'm sure about Justice Bentley had also made these observations, is if you can look at the reunification of families, because there's a restorative justice scholar named John Braithwaite, and he basically said that drug treatment courts are a reflection of the restorative justice movement, because when someone uses drugs, there's a separation between the family, between them and the community. And if you can reunify that thread with a family, then I think that is a factor in relation to success. Because if drug addiction also is reflected by someone using and being alone and then subsequently dying in the middle of an opioid crisis, then if you can somehow get that social cohesion back, then the law will follow down the road in terms of recidivism. Hopefully that answered the question.
Yeah, I think that's great. Maybe just the last question in terms of emerging trends. The law has to adapt to the movement in culture, and one of the themes that's coming up more and more, it has to do with harm reduction treatment courts. So are we ready to kind of take that step to the next side and say, safe use sites, harm reduction approaches? Is there a room for that, an appetite for that? Any comments, both as a researcher, but also what you've observed in your work on a daily basis?
Well, I mean, once again, you know, we do this lecture, we do the comments that people talk about in honor of Justice Bentley. And we do that because, you know, when someone's the founder and they make a difference in people's lives, and at a micro level, it's not just one person, but many, many, many people. And then that translates, if you look at it from you know, the ripple effect in a circle, if you can help somebody, one person, that helps their family, that helps society, etc. Well, there was a recognition right from the start of a therapeutic approach and an acceptance of a methadone program. That's not been the case in the United States. So that therapeutic approach, harm reduction, it's been recognized. It was recognized by Justice Bentley in terms of accepting methadone as an approved kind of therapeutic. And I think the insight case, because as I started with, who would have thought that, you know, we were all a number of us were in law school together. Who would have thought that we would have that comment from the Chief Justice of the Supreme Court of Canada talking about the charter rights of an intravenous drug user and how their life is really a risk every day. It's chillingly frightening. And so I think we are, I think we're already there. The Insight case spoke volumes. And by the way, that decision itself, the Insight decision, was 9-0 at the Supreme Court of Canada. It wasn't even close. So I think that was an endorsement that people have a charter right to health, to access to an Insight site. And I just encourage people to read that decision. It's really a remarkable, remarkable decision.
To bring it home, and I'll get to you, Brian, our local context, we've got clients in our program, and a marker of graduation is to be able to show that you're abstaining from your drug that's giving you problems and criminality for about 3 months, for 90 days, and then some. Do you think, Brian, we'll have a chance to get to a point where safe use is still a marker of graduation from a program like a drug treatment court?
Could you hear me?
Yes. Yeah, you're good.
Yeah, absolutely. Thank you, Honor. That was very enlightening. Let me tell you from a social determinants of health perspective. During the earlier days when the issue came up around, what they found was a number of opiate and cocaine users within Toronto Drug Treatment Court was using marijuana. And we had this in-house debate going back and forth for about 6 to 8 months. And I approached Justice Bentley and I said, Your Honor, how do you define success? I said, let me tell you how I define success. If Brian has been using 4 grams, whether cocaine or heroin a day, and I'm down to 3 or 4 joints, and I still have a stable lifestyle, I'm working, I'm employable, I'm contributing to society, that is success for me. I says, you know why? Because I work at the ground level. I work at the street level. I work and see people dying on the streets. We had, at that time, 3 public health vans with nurses, and we were covering all areas of drug use. I'll tell you what really worked also too, is the collaborative cross-sectoral approach. Let me read you something here. And this is from the Chief Coroner for Ontario office. And you can go on the website and see. They say, Office of the Chief Coroner for Ontario, for all drug-related deaths, including opioids, shows that there were 823 deaths in Toronto in 2020, which is 67% higher than 494 deaths reported in 2019. If you go on a bit further, CBC did a documentary on it. Ontario opioid-related deaths toll surged to 2,050 during pandemic, and this is May the 19th, 2021. One of the things we did very early on, Toronto Public Health was the first governmental system, if you want to call it that looked at opioid overdose deaths. We started our needle exchange, the works, and what we did over a period of time, we have a supervised injection site. We have overdose prevention training. We have a number of community-based service providers within their local jurisdiction trained so that when you see opioid overdoses, you could stop it. We have a supervised injection site that runs 7 days a week, guys, 7 days a week. And it's busy. We also do drug testing there. We also have an alumni or supportive group who are willing to be able to support people willing to come off. We have counseling. We have a referral treatment system. We work very closely with a number of hospitals in the area. If you didn't have these particular collaborative sites, you would see a higher number of people creating crimes, filling the jails. I can personally tell you, in the downtown sector, when we started that supervised injection site, a lot of the downtown business association was apprehensive, but over a period of months, it changed because you know what? Those people were not sleeping in the doorways. They were not trying to break into the businesses. I don't know if you know it, but the downtown business association is a very political, powerful group. And when they talk, people listen. We were able to appease that particular sector of the community because we had staff out there like till 10, 11 in the night. A number of community partner agencies actually have a night shift that goes in there. We have 3 mobile units that covered all the areas in the city, west and in Scarborough, where you have continuous drug use going on. So when you look at that collaborative approach, that helps eases the burden of drug treatment called being overcrowded. And Your Honor, you're right. Funding, I think, is a key piece, but I think when you talk about markers for success, definitely collaborative partnerships. And you have to remember, in the city of Toronto, just like Brampton, where you are, you're dealing with probably the 2 largest ethnic and cultural diverse and racialized communities. You're dealing with client populations that don't fit the norm. And like you were saying, you're dealing with, Your Honor, you had a Bangladeshi client. We have so many different cultural groups that come in that they can't get services unless you refer them to a culturally approached services. We have it in the city of Toronto. You're beginning to have it in Brampton. And one of the unique pieces that you need to do is get that community on board because they have a specific funding to reach out to their client populations. The LGBT community, the racialized communities, we have specialized connections with these community-based agencies to do that work. So it's how do you get rid of an elephant 1 bite at a time, right? But you have multiple people biting, which helps break down that dragon or that elephant that you're faced with. We can't do it alone. And that's why the community collaborative partnership model works so well. Justice Bentley saw that. Housing, here's some of the issues that we are facing. Housing, employment, social supports, poverty, crime, drugs, diversity, broad-based gender identities, employment. We have all those factors we face with, no different from where you are. So you have community groups willing to offer those services. The key piece is to consult with them and let them be a shared stakeholder within drug treatment court. That's where your real support comes from. Because when they do their stuff, where you think they go? Back out into the community. You can't do that alone. The court has one process in which because you're mandated to provide that. Hey, look, we offer opioid training. We offer methadone maintenance. We have people and we have naloxone kits. We train people all over. So it helps reduce that massive impact the court would see. Without that, you guys won't be able to survive.
You're right. You're right. You're absolutely right. Yes, Andre, Brian, thank you so much. Andre, you want to comment?
No. Thank Brian. Thank you, Your Worship. There was one last question, Miigwech to Beverly. We'll try and follow up with her offline. There's been many Aboriginal Indigenous clients in the Toronto stream, in the Brampton stream.
Yep.
It's a legal focused question about applying GLADU principles to any client before the court, whether or not they're in a treatment court or not. But please follow up with us, Beverly, okay?
All right. Well, it's 2:00. Interesting conversation. And certainly, Brian, we're going to have you. I can tell you, find a panel for you to be part of in the future. Your Worship, thank you so very much for being a part of this. We really appreciate it. A most informative talk. On June the 16th will be our next panel. And on a personal note, I can tell you that drug treatment courts started at a place that it had to start at a particular time. And drug treatment courts, like any other innovation, has to evolve with changing times.
Mm-hmm.
And having said that, the man who started us off, this was in his honor. And I think he'll be pleased by the questions, he'll be pleased by the engagement, and he'll be pleased by the tribute. And it is our hope that during this period of time, we'll be able to share something, learn something. There'll be more conversation, there'll be more webinars. If you can think of anything else you want us to cover, please check out the website and suggest some topics.